you come up and talk, or do you want to sit down?
For television purposes, it would help if everyone would introduce themselves when they step to the microphone. Spell your name.
Would you like us to do it prior to us talking, or do you want us to do it at the beginning? Everyone step up.
Either way, just so we know where everyone is. Yes. That'd be very helpful. Yeah, we're going to be live streaming this just like you guys.
Okay.
Are, so.
You're right. I'll start first. Beaver County Commissioner Daniel Camp, DanielCamp.
Commissioner Tony Amadeo, Amadio.
Commissioner Jack Lanning, like the football players, no relations.
State Representative Josh Kail, Kail.
State Representative Jim Marshall, Marshall. State Senator Elder Vogel, Eldervogel.
Good afternoon, everyone. I would like to also introduce, we have our District Attorney David Lozier and Sheriff Tony Guy here with us today. Last evening, I, along with my fellow Board of Commissioners, were notified by Governor Tom Wolf's office that Beaver County will be the only county in Western Pennsylvania to remain in the red phase for his process to reopen Pennsylvania. While the governor has consistently preached a regional approach to reopening, it has become evident that his previous comments were just merely another example of saying one thing and doing another. The Board of Commissioners can no longer stand here on mute. In disregard to multiple emails, text messages, phone calls we received from our residents and business owners asking us for help in reopening Beaver County. The same calls for help come with assurances that they will follow the mandated CDC guidelines. The governor's double talk means that Beaver County finds itself singled out as only Western Pennsylvania county in his administration's red category, surrounded by a sea of yellow. Not to mention surrounding counties in Ohio and West Virginia, which both have less restrictive economic measures and even are yellow phase. When Governor Wolf's plan goes into effect, the stark reality is an invisible wall surrounding and isolating Beaver County residents and businesses. But yet he and his administration believes it is okay for our residents to traverse to our surrounding neighbors, places of business, and do what we would normally do here in Beaver County. Our business owners and residents cannot become prisoners in our own county because of this unwarranted double talk. As Beaver Countyans, we are divided by rivers, but united by its people. And it shall be afforded the same opportunities as residents and businesses separated by a paper line on a map. We do not believe that our residents should be mandated to continue to live on an exiled economic island, forcing them to spend money outside of our county, furthering more economic destruction of our proud local business owners. Our restaurants, retail stores, and other businesses closed to the public will undoubtedly continue to suffer as a direct result of this administration's unwarranted and irrational decision. We say this decision is unwarranted and irrational because our hospital systems are not being overrun with COVID-19 patients, nor there's some communal spread throughout our community, and those are the ignored facts we are seeing today. The governor's warranted and irrational decision is simply based solely on one outbreak and one Beaver County nursing home. The challenges at this home have been heart-wrenching and very well documented as we continue to stay in touch with them. It's no secret that nearly 70% of our COVID-19 cases and more than 90% of Beaver County's COVID-19 related deaths are attributed to one nursing home in the county. And before it's even mentioned, we all know that the staff members there come in and out of our community. But let's get this straight. The doctors and nurses working at this home and the multiple others within our county have been nothing short of heroic. They've taken extreme cautions to protecting their colleagues, their families, and other communities to stop the spread of this virus. These medical professionals are modern day heroes, pure and simple. And there is no way, shape, or form that they should be the poster child to keep Beaver County in the red phase. Furthermore, the nursing home outbreak isn't a new development. It's been going on for weeks, and this administration's irrational decision to sit on the sideline at the beginning and the Department of Health's failed oversight is now resulting in the same administration punishing all of Beaver counties due to their own failures. Now, this seems harsh, but let's just look at the interim guidance of nursing homes during the COVID-19 that was published by our Department of Health on March 18th. It stated, nursing care facilities must continue to accept new admissions and receive readmissions for current residents that have been discharged from the hospital who are stable to alleviate the increasing burden of the acute care settings. This may include stable patients who have had or who have COVID-19. And it is this administration that unilaterally decided to cancel all inspections of nursing homes during this pandemic. From day one, nursing homes across the Commonwealth of Pennsylvania were set up to fail by this administration and the Pennsylvania Department of Health. And because of these failures, Beaver County residents, workers, businesses are being sucker punched, are being sentenced to an economic punishment, not for anything done by the great people of this county. Because our residents have shown relentless courage by helping their neighbors, our streetscapes and businesses have been empty for weeks. And while every county in Western PA gets ready to transition out of this crisis, we have been singled out. Because one isolated nursing home outbreak that the PA Department of Health utterly failed to assist immediately. So given the unwarranted, irrational, and punitive efforts of decision by Governor Wolf, the Board of Commissioners shall stand behind our district attorney in his decision not to prosecute any cases against a business that chooses to open and follow the mandated guidelines laid out in the yellow phase of reopening PA. We are certain our residents and business owners will be thankful for the united stance, and we all ask that you had reached out to us to also stand in successfully moving Beaver County out of the red phase. With that being said, we implore any and all businesses that choose to open and may open in the near future to please follow the mandated guidelines recommended by the CDC. This united stance, not dedicate finite resources to prosecute businesses merely for operating within the same guidelines as every other county in Western Pennsylvania, should not be viewed by any self-regulate, but to take responsible actions that are in the best interest of our community in accordance to the CDC mandated guidelines. I would like to have Commissioner Manning come up and then be followed by Commissioner Amadeo.
Okay, I'd just like to expand a little bit on what Dan said, and we're all in solidarity behind his comments. Those that know me and know me well know I'm a pretty pragmatic, data-driven kind of a guy. I gather the facts that are known. I analyze the facts. I see if something's implementable and can be done, and I look at what the impact that's going to be on people. And I have to say, I can't fathom ever making such a blatantly arbitrary and capricious decision that the governor has made based on one data point. Any analysis of the facts would draw you to a different conclusion. If the governor's purpose is to mitigate community spread or overwhelm our healthcare system, he needs to look at how contained the number is he is basing this decision that's impacting our community. As Commissioner Camp mentioned, nearly 70% of all of our positive cases are in one facility. Over 90% of the deaths are in one facility. It continues to be heartbreaking listening to the families who are unable to grieve the people they've lost under this current situation, and to listen for hours at those that have the angst and the heartbreak of not knowing what's going to happen to their loved ones that are still there. The governor's office this morning said we're trending in the right direction. No kidding. The rate's coming down because of the 458 residents they told us were in there in the beginning. 16% have died, and 67% have already been affected by the virus. That only leaves 75 or 80 people left that, pending the reconciliation of the data from the Department of Health, would be left to be infected. Well, of course, the rate's coming down. There's less people coming out of that facility that are increasing our numbers. We don't live on an island in Beaver County. 44% of the 53,000 approximate jobs we have in Beaver County are filled by people that are non-residents that drive into Beaver County every day to do those jobs. 40% of our residents, of our 85,000 or so workforce, get in their cars and drive south into Allegheny County or Butler County or downtown Pittsburgh to perform their jobs. And most of those jobs are already essential jobs that qualify under the governor's guidelines. If you look at our major business sectors, healthcare is 12.5%, construction 17%, trades and transportation and utilities is 20%. Those are all occupations and jobs that are currently being filled with people traversing our county right and left. Tell me how I can look in the eye of our small business owners and tell them that all these folks commuting out or commuting in can stop in Boone Township and buy something that they can't buy in Monaca or Beaver or Ambridge at their local small business owner. Tell me how that makes sense. I mean, any logical look at this data tells you that this is a flawed decision. And it's sad to all of us that, you know, our duty is to look out for the health, safety, and economic welfare of our residents. And I can't look our residents in the eye under this situation and tell them that we're effectively doing that. Thank you.
When Dan Camp called me last night and gave me the news about the governor's decision, it was just totally disheartening, because we were told for the past 6 weeks that we were doing a good job, we were doing a great job, and that the southwest corner was going to be able to move forward into the yellow. And then we found out last night that they put a wall around Beaver County. It was just, as I said, totally disheartening. We are together in this, the three commissioners. We had a discussion with a representative today, and he knows how we feel, believe me. And I'm sure when we were done, he gave the message to the governor. But now whatever the governor does with that information is going to be up to him. But he knows for a fact. Matter of fact, we were asked, is there going to be a rebellion? Is there going to be an active people getting together to go against this? I said, I cannot encourage it, nor would I discourage it. So the fact of the matter is that we are together on this, and we're going to stay together on this. I mean, as Jack alluded to, I mean, we're all on SPC. We know how our populations travel. So I have to go to Elwood City to get a haircut? Or does my wife, who badly needs color, I can't believe I said that. Yeah, who badly needs color, needs to travel to Cranberry or needs to travel to Robinson Township, as they go by our salons and our people's businesses. All this is doing, our people are still they're not gonna sit home. This Western Pennsylvania area has a history about laws and rebellions and how they're gonna handle this. The question is the governor gonna listen to us? Because the answer he kept giving us is that we were doing a good job. The whole southwest corner was doing a good job. And the only problem we have is a problem that we could not regulate. It's a problem that the Department of Health should have regulated. Thank you.
Tony Hopkins emphasizes the haircut thing.
Oh, I got one.
It's a personal problem.
Thank you. Josh Kale, I'm state representative here, Beaver and Washington counties. I'd like to start off by saying thank you to our local elected leaders. I think this bipartisan effort that you are putting forth really communicates the will of Beaver County and what we should be looking for going forward. And I do want to say that Aaron Bernstein is not here and Cameron Bartolotta is not here, but I've spoken to both of them and they are both in agreement with the actions that you are taking. So thank you for that. You know, the last 8 weeks, maybe longer, the House Republican caucus and also the Senate Republican caucus has been passing legislation, has been sending letters, has been pleading with the governor to change aspects of this order, to do something with our most vulnerable. And all that we've gotten in return is incompetence. Incompetence. When we have 1.7 million people on the unemployment rolls, and those some have filed in March, but still have not gotten a paycheck. Incompetence. A colleague of mine in Washington County had a young woman, a single mother, very independent person, worked all of her life, call his office, begging him to do something about this order. She had not received her unemployment compensation check. She filed for it in March. She was told she couldn't work because of the order, and her daughter were eating dog food. Incompetence. I want to talk about more incompetence. The Department of Health in March, 8, 9, I don't know how many weeks ago, a group of legislators, bipartisan group, on one letter, and another group of legislators in Washington County sent a letter to the Department of Health and the governor. We said, we have an empty facility in Elwood City, the hospital. We asked them, use this as a resource. If there's resources in there, if there's PPE in there, if we need to have a COVID county or in Western Pennsylvania, please consider using Elwood City Hospital. A group of us in Washington County, we got a letter together. There was a nursing home that was basically empty that contacted us and said, we will take the sick patients from Brighton Rehab. We have nobody in our home. We can separate them from the rest of the vulnerable individuals. But we sent that letter to the governor, the Department of Health. A couple of days went by. We reached out to them. They said they're looking at it. A couple more days, we're looking at it. A couple more weeks, we're looking at it. We're looking at it. Finally, in May, just a couple of days ago, I asked about it again, and they said, well, we're not sure if that's the best thing to do, to separate sick people from those that aren't, even in that setting. And I'm scratching my head, and Dan mentioned it earlier about the guideline from the Department of Health. The Department of Health, I looked, March 18th guideline actually mandated nursing homes to take patients back that went to the hospital, that may have been there for 2 hours, tested positive for COVID, but the doctor said, you know what, you can be discharged now because you don't need to be within this facility. They said you have to come back to the nursing home when they knew they had letters from legislators saying there are places we could send these people. There are places we could care for them, and that others in these homes that are vulnerable wouldn't be affected by it. Incompetence. And this is coming from the same administration that used as a rationale to let prisoners out of jail that crowded facilities were not the place where people should be, especially if you're sick. It's okay for our prisoners to get them to different locations, but it's not okay for our most vulnerable citizens in nursing homes. Incompetence. And now the county of Beaver is suffering because of this incompetence. And I would just like to say, Governor, reopen this county. The people of Beaver County have been diligent. We've worked hard. We've flattened the curve. We've done everything we can. Reopen this county. Thank you. Sorry.
I'm State Representative Jim Marshall. I represent residents from Beaver and Butler counties. And today, I'm glad to stand with our county commissioners and my colleagues here with us today, and those that couldn't. Representative Matzey was not able to join us, but he agrees with the position of the county commissioners. And we're all outraged at the flawed system Governor Wolf has taken to close Pennsylvania, to detain our residents, shutter our businesses, haphazard approach to reopen them. And we are all in agreement that with or without Governor Wolf's assistance, or help, we must reopen Beaver County immediately. We must return Pennsylvania back to its citizens. Thank you.
Hi, I'm State Senator Elder Vogel. I represent the 47th District, which includes Beaver County as well as Lawrence County and a portion of Butler County. So it's kind of hard for me when I'm sitting here in my home county of Beaver and it's closed, and Lawrence County today goes to yellow. Next week, Butler County goes to yellow, and here we are, Beaver County still being in the red. Obviously, as everyone has said, the commissioners, representative friends, it's very, very frustrating. This has been a flawed, knee-jerk reaction from day one. The governor's office and the Department of Health have had no real game plan as to how to do anything, from the fact that they right off the bat closed all the truck stops, and then they had to back that off and let people go back to the truck stops and everything. It's just been flawed from day one. They just have boggled it from day one as far as it goes. It's very, very frustrating. We have our caucuses by Zoom, so I hear all the other frustration from all the other senators, Republican senators across the state, and it's no different in the Southeast or the Northeast or wherever you want to go. I mean, obviously, nursing homes are a big issue. The county commissioners in like Bucks County and Montgomery County have even said, we just have a couple nursing homes. Let us segregate out the nursing homes like we have here. And the governor's office has said no to them as well. You know, and obviously car dealerships are impacted and things like that. Things that could have never been closed. Other states never closed them. Other states never closed construction. We're the only state to close construction. We're the only state in the country to close our liquor stores. I mean, just knee-jerk reaction, things like this that were unnecessary, that have cost the state millions and millions of dollars in revenue and tax revenue that we're going to hold, that we're never going to get out of for a couple of years. And it's just a shame. And obviously, I wish the governor would reconsider his position and get Beaver County back to working, because to have other counties working, like you said, we travel from, everybody's going to go from Beaver County now to Cranberry or Robinson or someplace to shop. And everybody in Beaver County is going to get stuck with no businesses in their stores. So obviously, it's very frustrating. And I stand with the commissioners, my representative friends, to obviously encourage the governor to please reconsider and open Beaver County as soon as possible. Thank you.
That's who we'll be speaking today, so we'll open up to questions.
Is this going to affect today that the businesses that we own are not being
So we will follow the new group of counties that are coming out of the yellow phase today when the governor makes his announcement at 2 p.m. So probably going into effect next Friday. Yes, but we're not up here asking businesses who wouldn't open in the yellow phase to open. We want to be considered part of Southwestern's region, and that would be the yellow phase. So any business that believes they could open through the yellow phase, we're here standing behind our district attorney and saying that he will not prosecute.
I wonder if the commissioner could clarify, you said you would not encourage or discourage acts of rebellion. I wonder if you could clarify exactly what you mean by that.
One of the things we were asked in the conference call, is there any kind of organized group that are going to fight this? And I said, not to our knowledge. They were trying to find out what this was all about. And I said, no, not to our knowledge. And that's where it ended. And that's why I came up with that.
When you say you wouldn't encourage or discourage, what is your, do you have a sense of those people who really are thinking?
I think our residents have been very good with this. Our business people are paying dearly for it. And I think it's time for us to go to the yellow stage in this. As we were pretty much, all the information that we got led to that. Matter of fact, as I said, I was totally disheartened last night when Dan called in and said everybody else but Beaver County was going to be going to the yellow stage. And that's not the information that we were receiving up to that point.
I can follow along. I don't know of specific businesses that are doing it, but we have been getting information from business owners who are saying effective next week they will open under the yellow phase, and they are notifying their local police departments to advise them that they are. So if the local police departments go out there, that's their decision, but we're standing behind the memo that district attorney put out.
You know the businesses that might be able to open, do you have any feedback how some of them will open, or they?
So, Thomas, I was just on a meeting 8 to 9 this morning with the Government Affairs Committee of that. There are a lot of businesses that are saying we can't stay closed any longer. Most of these, 70-some% of our chamber members are small business, 10 employee or less mom and pop shops. They can't stay closed for 2 to 3 weeks, let alone 2 to 3 months. And a lot of them aren't going to be able to come back up. And some of them have just reached out and said, we've notified, we're starting back up because I can't stay closed any longer. I mean, they're deciding whether to feed their families or pay their rent, for heaven's sakes. I mean, it's a dire situation for what's always been the lifeblood and the heartbeat of the economy of Beaver County, our riverfront towns and our small business community. And those folks, Dan said, and it's unfathomable how this, whether it was an unintended consequence or not, that the big box stores are still open and being able to supply people with stuff that the mom and pop shops can't. I can go into Giant Eagle and buy flowers and a card for my wife for her birthday, but I can't go to my local florist or local card shop and buy those. How does that make sense? How is that logical in all of this analysis by the governor based on one number? We have 75 cases per 100,000 people, and we need to get down to 50. And even though you're trending in the right direction, it just doesn't make sense. It's illogical. And I can't continue to look those small business owners in the eye and say, if you think you can start back up by following the guidelines, I'm not going to stop you. And he is going to prosecute you. So
I think it's also important to know were promised that they were going to be getting unemployment compensation. When this first started, we heard from every level of government, you're going to be taken care of. We're going to make sure we take care of you. And they were very patient. 4, 5, 6, 7, 8 weeks. There's still people that have not received their unemployment compensation. So you're talking about small business owners that didn't have resources like a large store did in the first place, who haven't had a paycheck or any source of income since the middle of March. And now it's getting close to the middle of May. And their choice is to reopen or to, just basically dissolve, start having to go to a food bank and do that and not feed their families that the state government put them in. That's a position that government has put them in. And it's something that we need to own and we need to understand. And going forward, we got to do better. As a state government, we must do better because the incompetencies is truly remarkable and hurtful.
More about the nursing home. There's been a lot of conflicting stories coming in about who's actually running the nursing home right now. The state has this consulting firm, and they say that they're not actually running it, but the nursing home is. What has been your communication with Brighton Rehab, with the Department of Health, about what is going on out there, and what more would you like to see done?
I think this goes back to Representative Kale's incompetency. Not your incompetency. The PA Department of Health, state government. Sorry, John. But what we get from the PA Department of Health is that they finally stepped in and started to do measures that they feel that need to be done. And our request back in March, when they had their first case, was to go in and start helping out this facility. They didn't do it for over a month. From what we know, we are being told from the PA Department of Health that they have a contracted overseeing it. What you guys are getting reports from the contracted manager, we got the same email from them saying we're not in there managing that facility. So when there's no communication, there's no open line of communication. The board has sat out in the courthouse steps earlier this year, requesting better open lines of communication from the PA Department of Health, the nursing homes, and from the majority of the nursing homes in Beaver County, we have been getting good communication. We pretty much know how many cases are coming out of Brighton Rehab, whether the PA Department of Health wants us to know or not. So I think it's important that that open line of communication continues, but it's not there.
As you know, Congressman requested CMS for federal investigation. What are your thoughts on that? What more?
So I spoke briefly about this on Wednesday, our first public work session since the COVID-19 happened. I agree with Representative Matzey in the state level calling for an investigation. I agree that Congressman Lamb is correct on saying there needs to be some oversight. Any nursing home has to be held accountable. But at the end of the day, it's the PA Department of Health's job to hold these nursing homes accountable. So if there is an investigation, I believe there needs to be one into the PA Department of Health and neglect of our senior citizens who are there. Because we called for help, the facilities called for help, and no help came for over a month. And we are where we are today because of the PA Department of Health.
They knew they were substandard to begin with. I mean, the ratings, they've been doing the audits and ratings. They already knew that Brighton Rehab wasn't up to where they should be.
I would just like to echo what the chair said, and also add, since I know I've been on phone calls with the Department of Health regarding Brighton Rehab since I believe the end of March or so. And every time we'd ask about this issue, we've been told that they're following guidelines, that they're doing the right thing, that everything is going along. And that may be the case, but we always responded, well, make sure you trust, but verify. Make sure you get people on the ground. In fact, one time I had made mention that could we get another doctor within the facility, because the people on the ground were saying, there's a lot of activity happening. And we got the same line the entire time until lawyers got involved, until the Department of Health got sued, or there was some class action lawsuit, and somehow lawyers got involved in the end of April. And then all of a sudden, there's been more activity since then. And all of a sudden, it's become this, smoke and mirrors. Investigations from the federal and state level, there should be oversight. There should be accountability. Our seniors need it. The families deserve it. That's why we have the Department of Health. They are a body that investigates. They're pull, revoke licenses of nursing homes. They can basically end a nursing home's ability to do what they do. And that's their job. Right now, I'm an attorney, so I feel like I can say this in good conscience. Right now, we don't need any more lawyers. Right now, we need health experts. Right now, we need to be assisting the medical professionals on the ground at Brighton Rehab to protect the seniors there that we can. And there's going to be plenty of time once the dust settles to make sure that things are had and accountability is had. But there's still an emergency there, and we need to be proactive with it. And it's imperative that it's health experts, not lawyers, that are the ones being proactive at this point.
Can I ask you a question just about fear of repercussions from this? So you're saying the district attorney is not going to prosecute when these businesses in yellow reopen. Okay, the county is on board with it. What about those state licenses? Is there a fear that some of those businesses who reopen could have those licenses pulled?
So I think that's why we ask those businesses to do it at their own conscience. I don't necessarily know how many businesses in the yellow phase right now require state license. A lot of them are done on the municipal level. District Attorney, I don't know if you'd like to speak to that.
Good morning. I'm District Attorney David Lozier, L-O-Z-I-E-R. As the Chief Law Enforcement Officer in Beaver County, I have two concerns. Number one is the safety of law enforcement. Police are a limited resource in a county like ours. We want to keep them safe. We don't want them going out and inspecting businesses unnecessarily because of the contact and the risk to the officers or families of the businesses. But second, whether or not these orders are in fact enforceable. Back on March 20th, I issued a guidance to all the police officers in Beaver County that I wanted them to exercise their due discretion in enforcing or not enforcing these closure orders, because I did not think they were enforceable. I'm issuing new guidance today to the police department saying the same thing, that they need to exercise their discretion. They need to preserve resources. I do not think that the closure orders identifying one business as being life-sustaining and the same business selling the same product or service is non-life-sustaining. I don't think it's arbitrary and capricious according to the legal standard. So I'm recommending that the police not get involved in these enforcement orders. The state does govern and regulate certain businesses, like restaurants. They have liquor licenses. That is a state police matter. That's not a local police matter. or other businesses that are governed by state licenses, those are administrative decisions, which we have no control over. All I can do is I can say that I will not prosecute a business or a business owner who has a complaint against them under these orders.
Do you fear that this possible scenario of having businesses reopen without the, punishment being doled out by the DA, do you fear that that might end up costing Beaver County more in the long run as far as, maybe the government will see this and see, oh, they're rebelling, keep them ready to law? Do you fear that that's a possibility?
If Governor Wolf makes his decision based on people wanting to earn a wage and decide whether they're going to pay their mortgage or feed their kids, I think Governor Wolf has a lot of questions to answer to himself, because if he's basing his decision on those accusations, we have a real issue in Harrisburg.
I think I'd like to also follow up on that. I think it's important that we realize that this state has 13 million people in it. And right now, whether we like it or not, and whether it's going to stay like this after this dust settles, there's one person that has control just about over everybody's life, and it's Governor Wolf. And so he has a lot on his mind. He's a lot that's happening, especially on the eastern side of the state. The situation is much different than it is on the western side of the state. I think what these officials are doing, and I'm happy that they are doing it, is raising awareness so that it does reach the governor and it does get a second look. And that's the type of action that's going to effectuate change in this situation. This isn't an assault on the governor. This is the constituents of Beaver County need some change here. And I'm very pleased that our local officials are communicating that to the governor.
Further questions? Thank you.